I am frequently asked, Doc, how do you diagnose a concussion? I saw this teenage athlete today and she got her bell rung pretty good. She had a number of different symptoms from headache, dizziness, nausea, difficulty focusing, concentrating, and they were like flabbergasted that I diagnosed them with a concussion. They said, Doc, isn't there just like a lab or a test or some scan we can do? And you know, we found, unfortunately, it's like the invisible injury. We don't have a good blood test. Not now, we're working on it, but we don't have a good blood test to diagnose concussion. Well, what about MRI and CAT scan? Did you know that MRI and CAT scan are actually normal in concussions? They're really good at diagnosing other brain injuries, but not concussion. So it's a tough injury. It's the invisible injury. No one really knows what you're feeling when you have a concussion. So we have to do a really good history. And most of concussion diagnosis is honestly based on history. And then it's just kind of complemented with some exam. And so it's usually headache in the setting of trauma, and they usually have maybe dizziness, they might have nausea, difficulty focusing, concentrating, maybe they have a little bit of memory recall issues, but a lot of times they're like, Doc, I just feel off. I'm just not myself. I have some cobwebs. So we really look at this questionnaire, and then we do an exam and look for a few key things. So someday there may be a simple blood test or a fancy brain scan that can help us with the diagnosis of concussion. But for right now, we really have to rely a lot on our history and our exam.